If you've recently been diagnosed with gallstones, you might be feeling a mix of relief to finally have an answer and maybe a little anxiety about what comes next. That is completely normal. Chances are you've been dealing with a very specific kind of discomfort, a sharp ache in your upper right abdomen, maybe accompanied by nausea or bloating, especially right after eating a heavy or fatty meal. To understand why you feel that way, we have to look at the gallbladder itself. This animation shows your gallbladder, a small pouch that stores bile. Over time, components in that fluid can harden and form these small, solid shapes. Those are the gallstones. As you can see, when one of those solid stones shifts and temporarily blocks the duct, it creates a bottleneck. That physical blockage causes the tissue to stretch and become irritated, which triggers the pain you feel. Because it's a mechanical blockage, a mechanical solution is the most effective way to eliminate the pain for good. To confirm exactly what's happening, doctors rely on imaging. This is a stylized look at an ultrasound printout. The machine uses sound waves to look inside your body, and that clear white shape, labeled here, shows your doctor exactly where a gallstone is sitting. Many people actually develop these stones and live their entire lives without ever feeling a single symptom. But once they start causing repeated pain or digestive trouble, the situation changes. When those flare-ups happen, treating the stones with a safe, routine surgery becomes the proven path to getting you back to living comfortably. Before you ever see the operating room, your care team will run through a standard set of health checks. This includes routine blood tests and a thorough assessment by the anesthesia team to ensure your body is fully prepared. You will also be asked to stop eating and drinking for a specific number of hours before your hospital admission. Fasting ensures your stomach is completely empty, which is a vital safety measure while you are resting under anesthesia. On the day of your surgery, you'll arrive at the hospital, settle in, and have final check-ins with your nurses and your surgical team. Looking at this checklist panel, these steps, blood tests, anesthesia checks, and fasting, might feel like a lot to manage. But your medical team follows this exact sequence every day because removing a gallbladder is one of the most commonly performed operations in the world. When it's time to begin, you are given general anesthesia. You'll drift off to sleep feeling absolutely nothing, and you'll stay completely unaware while the surgical team goes to work. The doctors will use a modern technique called laparoscopic surgery. Laparoscopic simply means using small cameras and long, thin instruments to work inside the body, minimizing the impact on your tissues. Instead of one large cut, the surgeon makes 4 small incisions. Thin instruments and a tiny camera safely enter these keyholes, giving the surgeon a magnified view. Through these openings, the surgeon detaches the gallbladder and completely removes it. Keeping the incisions small directly translates to less trauma for your abdominal muscles. That precision is what allows your body to heal much faster, with significantly less pain than older surgical methods. When you wake up, you will be in the recovery room. The nursing staff will be right there continuously monitoring your vitals and providing medication to keep your pain under control. It's entirely normal to feel some soreness near your incisions, and even a dull ache in your shoulder, which is just a harmless side effect of the carbon dioxide gas used during the operation. Before you are cleared to leave the hospital, your care team will want to see you hit a few basic milestones, specifically successfully drinking fluids and taking a short walk with some assistance. Before you go, they'll also brief you on what to watch out for. This infographic outlines the specific medical warning signs: a fever, jaundice or yellowing of the skin, persistent vomiting, or increasing redness and discharge from your wounds. Knowing exactly what to look for removes the guesswork from your recovery. If you experience any of those signs, you simply call your doctor, empowering you to safely manage your own healing environment at home. Let's map out what the recovery timeline looks like. This graphic shows your first phase at home, days 1 through 3. You can expect to feel tired, experience mild pain, and you'll need to prioritize rest. As the timeline moves into week 1, you'll start feeling up to walking comfortably and performing light daily activities. Moving further along, during weeks 2 through 4, patients smoothly transition right back into their normal routines. And finally, reaching weeks 4 to 6 marks the point of full recovery and a return to unrestricted physical activity for many people. You might wonder how your digestion works now. This 2D diagram shows your liver producing a steady flow of bile. Instead of storing it, the bile flows directly down this path into your intestines, bypassing the empty space where the gallbladder used to be. That biological adaptation means you naturally continue to digest your food. The surgery is a brief, safe disruption that resolves your pain and gets you back to living a healthy, active life.